Hi, Dave.
Hi.
How are you?
Not too bad.
On a Sunday morning, we're here now having
We're
discussions.
Sunday morning having a discussion, a nice discussion. How are you, Si?
Not too bad, Dave.
Yeah, not too bad.
Yeah.
So what we want to talk about? I mean, I want to talk about.
I think I like to talk
Do you
about.
want to talk about?
Yeah, I wanted to ask you a little bit more. I mean, I don't have to introduce you, Dave. Everyone knows who you are and everything of those.
And everyone knows who you are.
The good part of it as well, Dave, is just that now I wanted to understand a little bit more. The ICB fundings is cut and everything of those, the NHS and everything of those. And what I've realized over the past year, we've got a significant increase in diagnosis in terms of, ADHD, ASD kind of a concept, Neurodiversity kind of thing, developmental issues. And my concept or my idea is that just to understand a little bit more, are we actually over-diagnosing or are we under-diagnosing? Because people are more aware of things now, and that's why we are diagnosing to an extent.
Yeah.
And just to get your perspective in this as well, because I understand that, you're one of the person to speak to anyways. So just give me an idea, are we just medicalizing the entire thing? Or what's going on here?
So what's going on? So you make a good point. The essential question is there just a raising of awareness, or are people seeking something?
Yeah.
So, and then you have to ask yourself the question, what are they potentially seeking? And who is seeking it? Who's making this, who's driving this sense of an increased awareness? Is it because from a societal perspective, people are trying to seek an identity, and then they're trying to work out how perhaps they can fit into society, or what needs they might have, or is it that there's just there is a legitimate awareness coming from policymakers or even society itself, and saying, look, these people have needs, and we need to do something about it. What is driving this? The concept of over-diagnosis, are we just doing what we're supposed to be doing? Concept of under-diagnosis, are we still missing people?
Yeah.
But the question is, what are you missing? Or what do we mean by diagnosis? Because we use the term diagnosis, which means, is there a demonstrable pathology, or are we talking about formulation, or are we talking about something that just has shorthand? Because we know in psychiatry we can't define our cases really, and ultimately, you can get two different opinions about the same person. But does that really matter? Ultimately, is it just about the person trying to understand themselves? And you're an expert that understands, for example, the way they're interacting in the world in terms of their neurodiversity. Is that what's going on? What I think, this is my view, I actually think...
Is it a professional view? Is it your opinion?
No, it's my personal opinion. Okay. But it is underpinned by some sort of theory, but also my clinical experience.
Yeah.
My personal view, neurodiversity has always been there.
Okay.
But maybe it's become more fluid in a sense that it's become more stark because of the way society is. It's now expressing itself in a certain way, and equally, perhaps people are now wanting because of there's an element of destigmatization of both ASD and ADHD. I mean, ADHD doesn't have much stigma attached to it at all, actually. Because we're not associating with hyperactive kids necessarily. We're just associating it with people who perhaps could be creative. So
I'm just going to bring you on that point as well, Dave. Have you realized that things change? Those days when we were younger, we considered them as a naughty kid.
We did consider as naughty kids. That's right, which is fine. And kids,
now we consider them as ADHD.
Or pathological demand avoidance and things like that. So, but what's driving this? The question is, what's driving these, what we can call them labels or categories? What's driving this? Is it because we now want people to be absolved of their responsibilities? The person seeking something is because they want to absolve themselves from their responsibilities as a human being. Or that they're struggling to see their place in the world, and so they're seeking some sort of identity. And because there's perhaps less stigma attached to being ASD or especially ADHD, people think, it's my ADHD. That's the reason why I get addicted. It's not because I need to sort out my life. There's been some sort of trauma. There's family issues. No, it's my ADHD. I see that all the time, actually. I even see 70-year-olds saying that they've got ADHD. That's the reason why they've been addicted to alcohol for 40 years.
Yeah. Self-medicating as well, kind of a concept.
And there's a concept of self-medicating, perhaps, but self-medicating what? Are they self-medicating their ADHD, or are they self-medicating the fact they're not fitting in society? So this is why you cannot separate the individual from the society. It's impossible to do that. If you do that, then you actually end up just engaging in some sort of reductionism, where you think, well, actually, it's not that there's a problem with society and that people want to fit in and they want an identity. It's just that there's a disease and we've got to cut it out, and that's about it. So that's the reason why the concept of whether we're over-diagnosing, are we over-diagnosing, or we're just an awareness of problems in society.
Do you find that, as the era changes, and do you think that the more aware we become on things, and that's where the raise in diagnosis on things?
Completely. I actually think that's happening too.
Yeah.
So basically, you get interpretive bias.
Yeah.
If you're looking for something, you'll find it.
Yeah.
We know that as clinicians, don't we?
Yeah.
I remember there was a very famous professor of affective disorders. I can't remember his name. This is about 30 years ago. He was a brilliant professor of affective disorders. That's fine. But he used to diagnose affective disorders in everybody.
Because you're finding for
because
it.
he's looking for it.
Okay.
I mean, when you think about it, if you look for symptoms, you'll find it.
Yeah.
I mean, even that's why patients, when they engage in Dr. Google,
Yeah.
they can diagnose themselves with anything that they want to diagnose.
And now we have
Because of that
ChatGPT,
Yeah,
and we
yeah,
have
yeah,
lots
yeah,
of
yeah.
AI processors at this point of time as well. They just the thing which I kind of trying to understand, the concept of it, right? The waiting list in the NHS in terms of ADHD, ASD diagnosis is going to be probably, I don't know, 6 months, 12 months kind of a concept, or maybe longer than that.
Yeah.
Right. And what happens during that period of time? They're just continuing their lives.
Anyway.
Yeah.
So they get a diagnosis, right? And then what? I mean, ADHD people may argue, well, you can give them a stimulant, you can reduce all those thought tabs into one or two so they can focus. Yeah, but I'm not sure whether that's a good strategy to use stimulants long term. Personally, I think that's a big problem. But if someone's who's 70 with a heart problem and they suddenly have ADHD, what are you going to do then? What's the point of that? Haven't they worked themselves out by now? And then as for ASD, what are you going to give for that?
Yeah.
I mean, is it just about
There's
someone
no
understanding
medication.
themselves?
Why
There's
is
no
that?
medication for ASD.
But do you think that validation is important, Dave? Because we've been struggling, throughout our lives, right? For example, from young, we didn't fit into things. We literally didn't do anything. We didn't fit in. We couldn't get along with people. We had social struggles. We had that routines, repetitions, behavior, hypersensitivities, and all of those. Do you think that validating their feelings are important now?
Validating is important, and if there's the neurodiversity, there's something there.
Yeah.
But what sort of neurodiversity? Because we know that people present with, and someone with ASD, two people with ASD, one can be incredibly empathic because he has sensory needs.
Yeah.
The other one is lacks empathy completely because there's no theory of mind.
Yeah.
So they can present in completely different ways. So the key thing about the concept of diagnosis is making someone understand themselves so they can make their adjustments. So that validation is important. However, people have to understand themselves as a human being anyway.
Yeah.
It's not as if, I'm just someone with neurodiversity. No, then that's the question, and that's what people conflate.
Yeah, but do you think now we tend to avoid the terms ADHD, ASD? We tend to say neurospice kind of a concept.
We should do use sometimes.
We should just yeah.
Yeah, and I actually prefer the term neurodiversity to neurodevelopmental.
Yeah.
Because neurodevelopmental suggests there's something wrong going on.
Yeah. Like, overtly wrong going on over here. Like,
Yeah,
when you say
exactly.
neurodevelopmental, and then I was like, okay.
But what do we even mean by neurodiversity? Because neurodiversity could mean anything. It could simply mean that I'm different to you in the way I look at my brain looks at the world.
This is very important. Don't you think that makes everyone that's what makes me Sai? I'm different.
Exactly.
If I'm the same like you, Dave, then I won't be Sai.
Exactly.
Yeah.
Exactly. So when you extend the logic of neurodiversity, first of all, you keep it at ASD and ADHD because we know they coexist. And then you conflate it. Yeah, but I'm a bit quirky, but I haven't met the criteria for ASD or ADHD. So what does that mean? So neurodiversity can mean I'm different. We're friends, we're colleagues, whatever. But I'm neurodiverse because I haven't got the same brain as you. So of course I'm neurodiverse. So what do we mean by this?
Would you say traits are present then?
Traits could be present in everybody because we know it's a spectrum, but we also know it's fluid. So if there's a life event, you struggle to mask things like that. So the question we have here, Si, about the concept of over-diagnosis is when does someone meet the criteria? When? Because that's an element of judgment. Because there's no litmus test that say, oh yeah, you're ASD, you're not. It could depend on the clinician. It could be the clinician that just seems to see it. Maybe we're underdiagnosing. But underdiagnosing what? Maybe some clinicians are just not good enough at spotting it.
Okay.
Maybe there's a lot more out there. Or maybe we have a culture that creates the way we think. Like, people talk about ADHD culture, where, every time, there's always notifications on your phone, the adverts go back and forth, the phone is up, it's falling, and you think to myself, I can't sit down and reflect on anything. My attention is constantly going somewhere else. And then maybe you're creating your brain to be like that. Maybe we're all got ADHD. Just some of us, it's more apparent than others. This is the question. I actually think policymakers could be in a bit of trouble here. Because there's the argument there's an unlimited amount of neurodiversity out there because of the way the society is rewiring our brains. That could be an argument.
Sure. But do you think it's fundamental, that we sit down with our clients or patients, what we call them, right, and service users, help them establish something in their life, because they've been struggling. Right. Do you think that it's a duty or it's a response for
it is a duty.
A psychiatrist or any clinicians to such an extent that to say, you've been diagnosed with ADHD or ASD, right? This is the pathway you're going to undertake at this point of time. Why do you think that will make they've lived through their life? Because I remember this, having a conversation with a 70-year-old man, and he just wanted the validation. He just wanted to say,
there's nothing
inside.
I agree.
I don't require any support. I don't require any help. But I just wanted to know, was I different from everyone else? Why couldn't I fit in public to the society? I just wanted that. I just wanted you to see whether, are you able to acknowledge that from me? And I'm thinking to myself, I'm just sitting down there, just listening to him. It's like, you don't fulfill the entire criteria, to be honest with you, when you're young. You don't fulfill it. But you have adjusted your whole life to an extent that you kept that behind and you kept moving forward as well.
So what are you validating? All right, okay, you can validate the neurodiversity, which can extend to being an identity, but that still leaves the person as a human being. There's still lots of other attributes or aspects of a human being beyond that need to revalidate a particular neurodiversity. So the problem is, people think, the worry I have is, right, if someone's been diagnosed with ADHD and ASD, right, and they said, okay, I'm now revalidated. Are you? There's still other aspects of you that you need to understand, aside from your neurodiversity. Your neurodiversity isn't everything.
Yeah.
And that validation is really important. I completely agree with you. You're struggling, social communication, non-verbal, all that, that's fine. But you still need to adjust. You still need other ways to validate yourself, not just by getting a diagnosis. And that's why validation, as you say, I think is very important. But that's not the end of the road for you. You still have to understand. You said maybe you have an addiction as well, and maybe that could be related to the fact you can't emotionally regulate because of your ASD. It might be, but it might not be. Or it might be an element of something else. It might be the complex trauma, because everyone has complex trauma nowadays. Which is fine, that's okay. So there's much more to it than just validating a neurodiversity. But your validation isn't just about your neurodiversity, for example, you've been diagnosed. It's about other things as well.
Yeah.
And that's the key thing. And that's why I worry about people just thinking, right, I've got ASD and that's what it is. And that's right, and that's everything. And that's what I worry about. I'm not saying that everybody's going to be like that, but some people will be. And that worries me.
I personally feel that, since we're becoming more aware of ADHD, ASD, neurodivergence, kind of a concept here, we're not over-diagnosing actually. Perhaps we're under-diagnosed.
I think we could be potentially under-diagnosed. Yeah. I think that's correct. I think the concept of over-diagnosis could be something used by those sort of policymakers that don't want to pay for it.
Yeah.
Because at the end of the day, what's ultimately important is that we meet people's needs as a society, whatever that might look like. Yeah. And if the government, I know recently there was the question that we are over-diagnosing. I just think that's missing the point. What is your agenda for saying that we're over-diagnosed? Is it because you don't want to meet people's needs?
Yeah. Yeah.
That's the argument.
We could quite clearly see that as well in regards to how we are looking into things in perspective. You've got policymakers, as you mentioned quite clearly, that they make these changes and then now everything's like, oh, I think you're over-diagnosing, so no,
I don't think we are. I have a feeling we might even be under-diagnosing, right? But the question is what we do when we diagnose these people, and whether we can meet their needs, and whether the society can make that understanding. Do you see what I mean? Yeah. So I agree with you.
And the thing is that I'm wondering, now we've diagnosed them, right? And ASD, let's just speak about ASD, right? We've diagnosed someone with ASD at this point of time. And where do they go after that? because
That's right.
they go back to the GP has to refer to a therapist.
That's right.
And
Exactly.
that's another waiting list again.
Exactly,
meet the therapist.
exactly. So what you're correct. So what you're saying is that now we've identified a need,
Yeah.
and for ASD is therapy, really, isn't
Yeah,
it? And
yeah.
adjustments. So where are the professions to do that?
Yeah. We don't have that.
Exactly, we don't have them, and that's the question, because we do recommend. We make these recommendations all day long as specialists. We say, look, go back to the GP. We make those recommendations. But what has the GP got available for them?
Yeah. It's a struggle because they're quite short-staffed at the moment now. They are struggling as well, and then on top of that, you make some kind of recommendation.
Yes.
And now they're thinking, okay, where are we going to go?
Where are we going to go with this? So all we do, because who knows what's going to happen in the future, all we do is just do the right thing. As clinicians, as experts, we make the neurodiverse diagnosis because it's there.
Yeah.
They meet the criteria. What can we do? We can't pretend they don't meet the criteria because there's no therapist around.
Yeah.
And then we have to leave it at that, because what we're doing, we're identifying the need. And we cannot go against our professionalism and say, let's not diagnose them because there's no therapist out there for them.
Yeah.
You see what I mean by that?
And do you see now, people are moving out, in the sense that, if we can't get anything in the UK at the moment,
Yes.
why don't we get someone from
right.
India, Asia, or something on those lines, right? In terms of, let's do an online kind of a therapy. And it's much cheaper as well.
And it's much cheaper.
Everyone is just like, I know I'm diagnosed at the moment now. There's no capacity at this point of time.
Yeah.
And
Outsource it. Outsource it.
Yeah.
That's right, because there's still a need. However, you have to think creative. If your own country cannot meet that need, they have to be creative. And we see that in addiction, don't we? That people go to South Africa or other Southeast, and because they think, there's nothing here, and economically it makes sense, so they just do that.
it's cheaper.
It's cheaper.
Kind of a concept.
At the end of the day, yeah.
And you're sitting on a beautiful beach by the side.
Exactly.
You're going through your detox process at that point of time.
Absolutely, and that makes perfect sense as long as it it provides some sort of it meets the need to an extent. So, but I sense that there's a more neurodiversity out there than we're seeing.
And do you think that one thing I realized as well,
But we mustn't medicalize it, though.
Exactly. That's one of the main picture we need to make sure that we understand that, as clinicians, as patients, and every one of those. The thing is, I was figuring out as well, we've got private psychiatrists all over, right? We've got everywhere in the UK, But what happens when a private psychiatrist diagnoses a service user, but it's not recognized back?
It's not recognised.
So it's just like,
They go back and forth. That's right.
Yeah.
So they have to go right to choose, but who knows what's going to happen to right to choose? But even then, the share care agreement with the GP might not. It's not certain. But a private psychiatrist, what actually happens? A lot of GPs won't agree with their diagnosis or other professionals. So because they don't want to pay for the medication, for example. So the patient has to pay for the medication.
Yeah.
Is that right? Is that correct? Is that right? That's something's wrong there, because a private psychiatrist, they're as trained as any other psychiatrist. But why isn't their formulation taken as seriously as someone?
But do you think because people feel that because we're paying them more, so they just want to talk for more business, so they just keep diagnosing?
They keep diagnosing. That could be the answer. But psychiatrists are bound by code of practice.
Exactly.
They're regulated like everybody else. They have to go through appraisal, like everybody else. They have to revalidate. So they have to do the same as all the other psychiatrists. So their diagnosis, as far as I'm concerned, is just as valid as any other psychiatrist. I can make the argument they're more skilled because they see particular, they specialize in particular cases, for example. A neurodiverse expert sees a lot of neurodiverse patients. I know you can say, oh, that's all they'll see, but not necessarily. I'll be able to unpick. So you're absolutely right. There seems to be a different system for people who are private psychiatrists who cannot connect up as much with generic statutory services as someone who has right to choose or NHS.
Because to my concept is that all of us are governed by the GMC, first of all, and then they're all called psychiatrists.
Exactly.
Right? So we all come on the same port.
We do.
Concept. And then suddenly how things are different, like, why is a private psychiatrist not acknowledged kind of a concept? And why is, being in the NHS, you're much more acknowledged? So this is something which I was trying to figure out, as the chair of the Royal College in the Southwest as well. then my role is to encourage integration between the NHS, the independent sectors, the private psychiatrists, everyone.
Everyone, including addictions, private addiction centres, even supported accommodation, supported homes that provide rehabilitation, but they're within the private sector. Because the NHS needs the private sector. It needs the private, so it needs to connect up, and it needs to acknowledge and recognise and validate formulations are made that is not within their within their sphere. It needs to recognise that, and that's the only way it can connect. So this coming from a place of privilege is not going to do the health of the nation any good. Thinking, well, it's only our formulation, we won't take anyone else that seriously. I'm thinking, well, you have to. Without connecting up with the private services, whether it's addiction, whether it's neurodiversity, then you're not going to meet the needs of the nation. And this is an important principle here, I think.
And as we start learning a little bit more about neurodiversity, now we have more gender dysphoria coming into
gender dysphoria.
Yeah, lots of things are now emerging much more, and as we grow, I think we'll say that mental health is always going to be there. We struggle.
It can't go away. You can't pretend it doesn't exist.
No.
It's gonna pop its head up somewhere else. It's like whack-a-mole. You hit one head and the other head comes up somewhere else. So if the government thinks that it can just par down to the bare minimum community services, right, and think it's just going to go away. It doesn't go away. People pop up in prison, they become homeless. Neurodiverse people can't emotionally regulate if you're not having therapists for them. You just cause more problems. So this is what worries me. You have to recognise that at the moment the country is suffering with its mental health, actually, in general, for all sorts of reasons. We don't need to get into that. But it doesn't mean you can pretend it goes away and you deny those services that are picking it up. They're just because they're not in the NHS, where they're not really that legitimate, really. They're just touting for business. But we're just picking up needs.
What is required at this point?
What is required? Because as you say, we are bound by the same kind of code of practice, the same regulation as everybody else.
Sure. Right.
Thanks.
It's kind of a lovely conversation, Dave. So thank you very much.
Sai, you were very astute, and you got me there in the end. You came right there in the end.
Perfect then.
Thank you.
All right.
Cheers. Thank you. All right.